Good morning, everyone. Thank you for joining us. And we'll get that slideshow pulled up again in just a second. But I wanted to quickly say thank you for joining Health for a Change, ACEs, Substance Use Disorder and Prevention. My name is Allie Wells. I'm the Communications Director at the Foundation for a Healthy Kentucky. We are honored to have some really wonderful speakers joining us today to talk about this important topic. We have Barry Allen, President and Treasurer of the Gheens Foundation, Dr. Shannon Moody, the Chief Policy and Strategy Officer with Kentucky Youth Advocates, and Dr. Connie White, Deputy Commissioner for Clinical Affairs of the Kentucky Department of Public Health. First, just a little bit of housekeeping I want to go over. You can control whether you see closed captioning by selecting Show Captions at the bottom of your screen. We also invite any questions you may have throughout the webinar. You can just type them in the chat box or the Q&A box at any time, and we will address all questions at the end of the presentations. And just so everyone knows, this is being recorded, and we will also be sending out a link with all the slides when it's over. So I just wanted to tell you a little bit about the Foundation for a Healthy Kentucky. We are a nonprofit, nonpartisan organization that aims to create an environment where every Kentuckian has what they need to live a healthy life. We want to make the healthy choice the easy choice. And to do that, we try to address disparities and improve policies and programs on the state and local levels around our two focus areas, which are children's health and access to care. We can move to the next slide. Here we are. And let's go one more slide now. Awesome. So substance use disorder is a critical health concern in Kentucky. And we know that prevention efforts are so important because we need to break the cycle for our next generations. And so at the end of this webinar, we hope you'll all be able to walk away and understand how childhood trauma, known as adverse childhood experiences or ACEs, makes a person more at risk of developing SUD. What are examples of ACEs interventions and SUD prevention, and how an initiative called Bloom Kentucky is working to increase these efforts across the state. Our first speaker today is Dr. Connie White. Dr. White practiced OBGYN in Frankfort, Kentucky for over 20 years. She retired from clinical medicine and joined the Kentucky Department for Public Health as the Director of Division of Women's Health in 2009. She moved to the College of Public Health at the University of Kentucky in 2011, and then back to KDPH as the Deputy Commissioner of Clinical Affairs, a role she has had for more than a decade. Dr. White, the floor is yours.
Thank you so much, Allie, and thank you for inviting me to come and represent the Department for Public Health. And thank you for bringing this topic to the public. This is by the great response of people wanting to listen in today. It's obviously a topic that people are hungry to learn more about. So I'm going to do a kind of an overview for you today, and then Dr. Moody will get a little bit more into the topic. But next slide is the slide that if I were in a room right now and could see everyone's face, I would ask everyone to give me a word. What do you see when you see this picture? And the words that I usually get if I were in public with you or in person with you is sharing, sweet, cute, affectionate, diverse. All of those words are words that we come up with when we see those itty bitty babies. And then we begin to step back and say, what happened? What happens to those sweet, cute, lovable, diverse, caring, sharing babies after those early years? So the next slide is going to show you a map. And this is a map of counties with persistent poverty. So this means these counties that are highlighted in purple have at least 20% or more of that population in that county have lived in poverty for the last 30 years, 1989 to 2019, which is when this map was produced. And if you'll go to the next slide, I zeroed in on Kentucky so you could see Kentucky. Since I'm public health, we're all about data. I apologize for the quality of this, but it gives you a look at where we are in Kentucky with persistent poverty. And I'm going to show you a whole series of slides, just kind of boom, boom, boom in a row. But I want you to visually keep that picture that you see right there. This is persistent poverty, 20% of the more of the population over the last 30 years. So the next slide that you're going to see is a slide, a map from our K-Stats group, and that shows you more current poverty in Kentucky. This is all races from 2017 to 2021. And as in most maps with public health, the darker the color, the higher that rate is. The next slide gives you a very similar map from K-Stats, but it shows kindergarten readiness in that county. So the darkest colors show that below 42.2% of that population has kindergarten readiness. The next slide that you see is showing you education in those counties, what percent of the population has less than a 9th grade education. All of these are going to fit into what we're going to be talking about, ACEs. And then the next slide I got from the Feed America map. This is their map of meal gap map. And this shows counties in Kentucky and what percentage of that population fits the food insecure definition. The darkest county there, and I wanted to be sure everybody knew where that was. If you live outside of some of the metropolitan areas, you might know not all our counties, but that county is Wolfe County. And Wolfe County has a 24% of that county population is defined as food insecure. I looked at all the surrounding county, all 6 of those counties. 3 of those 6 counties have over 20% of their population food insecure. Of the other 3, at least 15% of that population is food insecure. So that gives you a mental picture of where we are in Kentucky when we're looking at poverty, kindergarten readiness, we're looking at 9th grade education, and we're looking at hunger. They also have a senior map if you want to go to their website, and they show just food insecurity in seniors. The next map is going to introduce you to a concept that I wasn't familiar with until just recently, and this is a Child Opportunity Index. And what this website does is it talks about how neighborhoods matter with children. And children that grow up in communities where there is quality early childhood education in schools, where there's safe housing, where there's healthy food, healthy parks and playgrounds, and where there's clean air. These children grow up to be healthy and productive adults. So again, I zeroed in where they measure on the map the quality of the resources and the conditions that we just discussed. And the next map shows you what Kentucky is. Again, the quality is a little difficult because of the way I zoomed in, and I apologize for the red line. I actually did that with my finger. I'm getting really high tech here these days in my older age. So that's not exactly the outline of Kentucky, but it gives you a pretty good idea. And you can see that according to the index, the darker the county is, it just goes from a very high down to a very low childhood opportunity index. And I don't think it's going to be real surprising when you look at those different colors. Your darker colors are around your more urban areas. The lighter colors, the low and very low childhood indexes are listed there. You can actually go in and click on each area, and it will give you not only the number of the childhood opportunity index for that track, but it also will break that down into the educational index, the health and environment index, and the social and economic index. So to give you a better example of this, the next slide is a picture of redlining in the city of Louisville back in the 1930s. So for those of you that are familiar with this, red and yellow areas were determined at the federal level to be less desirous places for real estate, and the green and the blue were a higher desired area for selling real estate. And if you go to the next slide, I tried to take the childhood index and match it next to what was recommended 30 years ago. You don't have to know the city of Louisville to understand this map. All you have to do is look on the left where the blue and green is, and look on the right where those darker areas are, which are the very high indexes of children developing into those highly healthy and productive individuals to see that this type of limitations for children over time really makes a big difference. In the next slide, we're going to talk about ACEs. I think probably most of you who are on this webinar are going to know what ACEs are. But these are a series of 11 questions that go over abuse, childhood abuse, and household dysfunction. These are asked of adults over 18 years of age, and you ask them to think back if any of these things happened to them. And if they give the answer of yes to any of these, this is not severity, this is just yes, it happened or no, it didn't, then you get a score in those 11 questions, and that's your ACE score. The next slide shows you a pyramid. Public health is very excited. Everything we do in pyramids. And this shows that the traumatic historical events that happened before this child was born, social conditions, the adverse childhood event and condition experiences that affect neurologic development, adopting difficult risk behavior, as well as increasing inflammatory markers in the bloodstream to increase chronic diseases, leads to disability and death. In fact, if your ACE score is 6 or higher, you are more likely to die 20 years earlier than your peers. The next slide just takes those high ACE scores and shows you that you're more likely to have fractures, burns, traumatic brain injury, different types of mental illness, my world of unintended pregnancy and complications from my OB background, STDs, HIV, cancer, alcohol and drug use and different types of drug use, as well as lower educational opportunities. And the next slide just shows in the Kentucky, when we ask these questions on our BRFIS phone survey, we looked at a lot of those indicators. The dark blue bars are Kentucky, the lighter blue bars are the United States. And it shows that in things such as mental illness with depression, we are a lot higher. And then the health issues of high blood pressure, cholesterol, arthritis, asthma, COPD, diabetes, all of those things are higher in Kentucky. The next slide is from the KIPRIC website, and I tried to put links to all of these on the slide, so if you want to look those up later. KIPRIC looks at overdose rates, and it breaks it down by fatal overdose, non-fatal overdose. You can look at different drugs. You can look at all drugs. So I just did this snapshot, and this is 2018. Now go back to those maps that you have this mental picture of. This is 2018. And fatal overdoses, any drug. And then the next map shows you how that changed from 2018 to the map of 2022. And that's the next slide that shows you how that number has increased over time. So I think we can see that all of these things are connected. In our next slide, we talk about children as collateral damage of the opioid crisis. We're 6th in the nation for kinship care. We've got one of the highest rates of grandparents raising their children. A lot, and I would dare say most of that is because of substance use disorder where parents are unavailable or they're in jail. 1 in 10 of children in Kentucky have a parent that's incarcerated, and we're 7th for childhood poverty. The next slide talks about children with parents with substance use disorder. They're dealing with police in the home. They're afraid their parents are going to get arrested. They're afraid of coming home and a sudden death has happened in their home, and there's often inadequate availability for children, and that leading to neglect. And then finally, in studies that they've done in treatment centers, and they've looked at ACE scores, the next slide shows us that if you have a score of 8 or greater, 3 times more likely to misuse prescription drugs, 5 times more likely to inject. Trauma history is seen to have people reach out, have chronic pain and reach out for medication, as well as people seeking substance use disorder treatment. At least 80% or more have at least 1 trauma in their history, and 2 out of 3 have witnessed violence. I'm going to jump ahead of Barry in the next slide and show you a slide that I've just stolen from them, and I use it all the time. We're going to break it down so you can read this a little bit better, but visually I think it's just lovely. And it shows not only the adverse childhood experiences above the ground that we measure through the ACE score, but also the root system. So the next slide shows you how, if we look at just the ACE scores that we measure in our interviews, look at all of those things. All of those ACEs are going to contribute to someone eventually going into a situation in their life where substance use and misuse is more likely to happen with them. All of the abuse metrics, the neglect metrics, witnessing domestic violence, a parent in jail, living with someone with either a mental health issue or an alcohol issue. And then the next slide looks at the bottom of that, that previous metric or that previous slide that shows us children living in poverty neighborhoods, high poverty level. We already talked about 22% of Kentucky's children are living in poverty. The 4% who've witnessed violence in their communities. All of these things contribute as that child's neural pathways are developing, as they're learning how to make choices, healthy choices, unhealthy choices, as they're chronically stressed and their cortisol levels are chronically elevated, leading to these chronic medical diseases that we talked about earlier. All of these things contribute to how that adult is going to develop and what kind of healthy choices, healthy outcomes are we going to have in those children. I don't want to be gloom and doom. I want to talk about some new science. The next slide talks about balancing adverse childhood experiences that we talked about with positive childhood experiences. And I love the term, the science of thriving, because we have a lot of people in this state that have had adverse child experiences in huge groups. In fact, if you look at people in the helping careers, many of them have had high adverse childhood experiences. But if you also screen them, they've had positive childhood experiences. The next slide, and I know that Dr. Moody's going to go into this in a little bit more depth, but those positive childhood experiences show positive interactions in their families, their ability to talk to people, dealing with difficult times, feeling protected by an adult, the community that these kids will feel with these positive childhood experiences. All of those things on this slide point to positive childhood experiences and how that can combat the ACEs that we see. So the next slide shows you the paper that they did at the Hope Center at Tufts University, where they looked at these childhood experiences. And to give you just some bullets or some talking points out of this, the next slide shows you that what they found was positive childhood experiences can mitigate negative childhood experiences in that young adult's life. The next slide shows us that positive childhood experiences are critical even if there aren't ACEs. So if you've got an ACE score that's really low or 0, but there's no positive childhood experiences in your life, you are not going to have that good trajectory, even as compared to someone with high ACEs, but a high PACEs score. And finally, you're going to learn that positive childhood experiences are a dose response curve. Just like the higher your ACEs score, the more chronic disease and other types of negative health outcomes you're going to have, the higher your positive childhood experiences, the better those outcomes are. The next slide is just a really nice slide that shows all of this. These are all 3 of those bars are people with ACEs of 4 or higher. The purple bar has 0 to 2 positive childhood experiences, the middle bar 3 to 5, and the green bar 6 to 7. 6 to 7 positive childhood experiences has a 20% chance of depression versus the purple bar of 60%. That's a dose response curve. The next 4 slides we're going to go through pretty quickly, but this just shows from their HOPE study, and that stands for Healthy Outcomes with Positive Experiences. They found 4 building blocks. And these building blocks are, next slide, relationships, making sure these children are relating to someone, adults and children. The next slide talks about safe and equitable, stable environments. So these kids feel like that not only their home, but when they leave their home, they're in a safe space. The next slide shares that social and civic engagements, that they're involved with teams or they're involved with school activities or something that they feel connected to. And then the last slide talks about emotional growth, that these kids can play with other kids, they can share, they can do all these things instead of staying holed up in their home without those type of interactions. And you might say, well, don't we already know this intuitively? Well, we do, but this work is measuring it scientifically and proving to people this makes a difference. The next slide just introduces you to a program I'm a part of, Partnership for Resilient Kentucky, or PARC. The next slide gives you a definition of PARC. We meet twice a year. It's virtual. It's not a grant. There are no deliverables. There's not a report, but it gives people across the state an opportunity to learn the more of the new science of thriving and to share work they're doing in their communities where you might can look at that and go, oh, we could do this in where I am. We could do this where I live. The next slide is just some icons of some programs we have in the cabinet while you're working on your community projects. Look out and see if there's already people working in that space, people you can partner with, that you can grow with. All of these programs, and this is just a small snapshot of programs across the state that are already working on these areas of positive childhood experiences that your work can continue to grow. So the next slide tells us that ACEs are not dictating this person's life story, that if we've got positive factors, a nurturing adult, we can actually cushion these adverse childhood experiences. So the next slide, if you go back and remember our babies that we started with, well, they've turned into adults. And what happened between that first picture and this picture is going to tell us what kind of adult we're going to have. Are we going to have a Kentucky citizen who has a healthy life, who has an engaging life, who has a life that gives them meaning and purpose? Are we going to be dealing with people that have a lot of challenges and are not able, because of those early experiences, to have the skill set to overcome? So the next slide is just my contact information, and I want to turn it over now to Dr. Moody, and she's going to give us a better insight of this. So I'll be available for questions at the end. Thank you, Allie.
Thank you, Dr. White. That was great. And we're actually going to go to Barry Allen next. Barry joined the Gheens Foundation as its president and treasurer in 2015. Before that, he was the president and CEO of the Kentucky Baptist Foundation. He is also currently an active member of the Metro Louisville Opioid Advisory Board, and he is here today to talk about his work with an initiative that's known as Bloom Kentucky. Barry?
Thank you, Allie, and thank you, Dr. White, for informing us about this terrible circumstance, but also giving us a sense of hope and optimism about the future. And I also want to thank each of the participants in this session today for taking time out of your busy schedules to participate. I'm delighted to bring you greetings on behalf of the 32 grant-making organizations from around the Commonwealth that came together in 2019 to engage in a united statewide public policy advocacy initiative to reduce the impact of ACEs, to give Kentucky's children and families a sense of hopefulness, not helplessness, which in turn will result in a healthier and more prosperous future for all residents of the Commonwealth. I wish I had time to share the remarkable story of how this initiative came to be, because it is the first time in history, as far as we know, such a coalition of grant makers has come together around any cause. But what's important for you to know, I believe, and what is so unique, exciting, and satisfying about Bloom Kentucky is these grant makers decided to move out of our comfort zone of making grants and into the public policy arena as a new part of our missions. So in addition to making grants and using our financial capital, we also want to use our human capital. We came to the realization that after decades and millions of dollars of grants to and through hundreds of worthy charitable organizations, seeking to provide solutions to the needs of those they were serving, that our dollars and our efforts were not moving the needle. We were providing funding for important and needed relief in all aspects of human services, health, education, jobs, art, the environment, and so forth. But that relief was only temporary. As a result, our dollars and our efforts were not improving the undesirable and unacceptable circumstances in the lives of the people we were seeking to serve. So to effect systemic change required us to move into the realm of advocacy, which includes education and awareness, not lobbying. We are seeking the attention of policymakers as well as the general public. We are educating, encouraging, and enabling policymakers to plead the case, to enact changes, and to provide funding that will address the multi-generational challenges of ACEs, and to move upstream to prevent these experiences from occurring in the first place. Our 2024 policy priorities range from eviction expungement, the housing crisis, birth centers for equitable prenatal and delivery care, school-based mental health providers, and student-teacher compensation. We have budget priorities in the areas of childcare, education, family support, and health. And as we got into this, it didn't take us long to realize the correlation there was between addiction and ACEs. And so a small group of us grant makers proceeded to seek an audience with then Attorney General Daniel Cameron to plead the case to apply at least half of the opioid abatement settlement dollars, over $400 million, to apply those to prevention. We know treatment and recovery is ongoing and important, but we felt someone needed to plead the case for prevention. And so we offered the commission, the abatement commission, which Attorney General appointed. We were connected with that group, and we offered them the benefit of our wisdom as grant makers, the kind of things that we do on an everyday basis. And they were really starting from scratch. So we offered our assistance and they graciously accepted it. And we have an ongoing relationship with that group even today. So let me conclude with this. Our coalition is indebted in particular to Ben Chandler, who is president of the Foundation for a Healthy Kentucky, for his guidance and encouragement all along the way. And also to Terry Brooks and the competent and capable assistance of the Kentucky Youth Advocates Bloom Kentucky team as our coalition's backbone organization. And Dr. Moody, who you will hear from next, is a big part in leading that assistance. According to the late Fred Rogers of the children's TV series, Mr. Rogers' Neighborhood, he made this observation. He said, "The future belongs to those who give it hope." So I want to thank each of you for holding in your hearts with compassion these victims of child abuse and neglect, and for the passion with which you are making a difference for the current and future generations of the Commonwealth's children and families to give them reasons for hope. Together we can and we shall make it happen. So let's be resistant and not give in. Let's be consistent and not give up. And let's be persistent and not give out. Thank you.
Thank you so much, Barry. So we've heard about how ACEs can put a person more at risk of developing SUD. We've heard about how this great initiative is working to get more ACEs interventions going on in our state, but what exactly could those interventions look like? And that's what our next speaker is going to talk about. So last but not least, we have Dr. Shannon Moody joining us. She is the Chief Policy and Strategy Officer with Kentucky Youth Advocates. She has over a decade of experience working within the child policy sphere. She works closely with advocates, lawmakers, individuals with lived experience, government agency administrators, and professionals who serve kids and families directly. So, Dr. Moody.
Thank you so much. And I'm so grateful for Dr. Connie White's presentation and really helping to set the foundation. I'm going to hopefully build off of that. And I do want to say that Barry Allen has just been an incredible gift to this work. And Bloom, Kentucky would not be here if it wasn't for Barry and his taking a chance on really engaging in policy and systems level change when it comes to addressing the adverse community environments that Dr. White had talked about, as well as adverse childhood experiences. So I just really appreciate that. So I'm going to jump in to not super granular level, but a little bit more granular when we talk about adverse childhood experiences, and we'll also talk about positive childhood experiences and what that can look like as far as making change so that we have kids who are healing from adversity, who grow into adults who are happy, healthy, hopeful. So this is actually from the Centers for Disease Control, and they had put together a whole toolkit around preventing adverse childhood experiences. So if you're not familiar with it, I'd highly recommend checking it out. But they lay out really clearly the potential strategy when it comes to preventing adverse childhood experiences or adverse community environments, and then what the potential approach can look like. So we are really going to dive in more to each component of these strategies and talk a little bit about what Bloom Kentucky is really focused on that policy and systems level. And I'll also talk about some practice level initiatives and work that can be done. So on the next slide, I bring in some information about a study, and Dr. White had really clearly made the connection between preventing substance use or addressing substance use when it comes to adverse childhood experiences, and that connection between childhood adversity and substance use. We know that when kids have adversity at a young age and it's persistent or it's untreated, and that stress is untreated, it is likely to lead to unhealthy coping mechanisms like using substances. So oftentimes, we see young people, sometimes between the ages of 10 and 14, using nicotine products, alcohol, and then moving into other substances. We know that if kids have an opportunity to deal with stress and address the stress that they're feeling in healthy and positive ways, they're going to have better outcomes long term. You're not going to see that the things that come along with addiction that Dr. White had identified as far as employment issues, other health issues, and things of that nature. So we know that mitigating the impacts of stress for kids, for families, for the community really creates the opportunity for reducing the likelihood of substance use or misuse. So obviously in Kentucky, we have experienced the really severe impacts of the opioid epidemic. And Bloom Kentucky is very interested in engaging in community conversations and conversations on the systems level with folks who want to get upstream around preventing substance use. Obviously, it's a really critical need to make sure that we have all of the treatment and recovery options for folks who are currently struggling with addiction or who are in recovery. But also, we would like to get further upstream so that we are addressing the issues where we see young people potentially leaning on or getting engaged in substance misuse that then leads to problematic health and mental health issues. On the next slide, we talk a little bit more about positive childhood experiences. So Dr. White had mentioned the study. She mentioned the dose response piece. And then she also mentioned those 4 building blocks. And I want to revisit that again. Those were relationships, safe, stable environments, social and civic engagement, and then emotional growth. So when we think about where those positive childhood experiences can occur, not just in the home, but also in any environment where a child is. We want to think about what can support those positive childhood experiences and really build out those 4 building blocks. So obviously within relationships, that's supported parenting and caregiving, making sure that parents and caregivers have access to postnatal supports, prenatal supports, home visiting programs like the HANDS program, and other stabilizing supports like safety net programs if there's food insecurity, housing instability, and things of that nature to prevent that adversity from impacting children. On the safe and stable environments, obviously a safe community, reducing community violence, reducing poverty, those are going to be aims for that building block. Social civic engagement. I'm going to talk more about this in just a second, but activities for young people that reduce isolation and build connection. We have a lot of young people, especially who came out of the pandemic with really severe mental health challenges or exacerbated mental health challenges that they had not even seen before because of some of that isolation and the stress that they were feeling in their homes. And then that emotional growth piece, we know that emotional growth can start as early as a child enters childcare at 6 weeks old or really before that. So making sure that quality childcare and some of those pieces are considered in that emotional growth piece, as well as other opportunities for young people. So on the next slide, we have a map here. So Bloom, Kentucky went across the state. We made 19 in-person stops across the state to get a better understanding of what does resilience building look like in our communities? What is potentially hindering or impacting resilience building? And what do we need to do on a systems level and on a community level in order to address it? So our Bloom, Kentucky folks had kind of focus group oriented conversations within organizations, neighborhoods, communities across the state. And we then pulled everything that we heard together and started to identify some themes out of those, some of the challenges that folks were seeing. So childcare, housing, mental health, community violence, substance use obviously was a very big one, food security, workforce, and then kinship family supports. So we know that those are issues and areas that are that need to be addressed across Kentucky to really make sure that we have the tools that we need in order to build resilience in our kids and our families and in our community. On the next slide, I'm going to talk more about where Bloom, Kentucky is focused within. Really, we think about systems change, and we're thinking about all 3 branches of government. So administrative reforms and the needs to address. I don't know if folks remember the bottom half, or that I think it was the second slide that Dr. White had shown, was those adverse community environments. That's where we're really taking a hard look at what needs to happen in our communities in order to ensure that our families have the opportunities that they need to build resilience, and our systems are not hindering that resilience building or are not potentially causing more adversity or harm for our kids and families across the state. So we're looking at things within Bloom around social service enhancements. We saw an increase in the TANF, the Temporary Assistance for Needy Families subsidy that is provided. It hadn't been addressed or changed since 1996. We finally saw an increase in those cash assistance supports to some of our most needy families who are attempting to get on their feet, many of them working, but really struggling to make ends meet. Making sure that there's education and awareness around existing programs. I really appreciate Dr. White lifting up some of the programs that within the Department of Public Health and then the Department for Community Services that are offered for families who are seeing some challenges, who might need a hand up. On the judicial level, we know that parental incarceration is problematic, and we also for kids and also the parents, and it causes an adversity and more stress, not only because the parent is incarcerated, there's a loss of income, there's that loss of connection. So it can kind of have an exponential impact. So how do we make sure that we are holding parents accountable in ways that really minimize the impact of parental incarceration and the impact on kids? There are different community-based interventions that can work, where for people who have really low-level nonviolent offenses, they can stay in their home, be held accountable for what needs to happen, and still maintain their job and still maintain that connection with their family. So there's a lot of administrative and judicial reforms that we're considering and looking for on the systems level. And then on the next page, we're actually on the next slide, I'm sorry, we're on day 12 of our Kentucky General Assembly. We are in a 60-day session, and that's also a budget session. So Bloom, Kentucky is pretty actively involved in monitoring what's happening within the state legislature. And that means making sure that folks are educated on what's being filed, what seems like it would be supportive or potentially impactful for resilience building and creating more positive childhood experiences, or addressing those adverse childhood experiences. So what we're really focused on are the priorities that are listed here, that have a lot to do with stability for families in community. So safe housing. Specifically in Kentucky, it would be surprising to know, but there's a lot of issues when it comes to eviction filings, and evictions will stay on your record for your life if you get an eviction. And that makes it really hard for a family who maybe has an eviction, who is able to then get back on their feet and they're ready to go back into a rental situation, and then they get dinged because they have this eviction on the record from like sometimes 10, 15 years ago. And unfortunately, minors right now are being named on eviction filings, which is really problematic, because once a kid turns 18 and they go to rent an apartment or a house, that eviction is on the record, even though they really didn't have anything to do with the reason why it was filed that many years ago. We are focused on maternal mortality and maternal health. There are a couple of bills that have been filed this session that we're keeping a close eye on, that we're feeling pretty good about. And then childcare. I had mentioned that one of those building blocks being the emotional growth. We know that kids and families who have access to quality early childhood education and childcare are better off when they enter kindergarten and enter school. And then what we know is that they have better social and emotional competence. They are able to, connect with their peers. They're more able to share, and then also have that cognitive, those learning opportunities for when they head into further schooling. We are also really interested in making sure that we have strong mental health providers who are providing services across the state of Kentucky. We have we have gaps and deserts around mental health access, and we also have providers who are not really interested in using or taking clients who have Medicaid, because the Medicaid reimbursement rates are lower than what they would like to see, and that what is feasible for them to be able to keep their doors open. So we have less and less providers who are willing to provide mental health services because of some of those Medicaid reimbursement rates. So we're really focused on those issues, and I'm happy to answer questions about them when the time comes. But I would really like to go into the opioid settlement and a little bit of information around what we're doing there. I know Barry had mentioned it, but on the next slide, we have kind of a breakdown of the opioid settlement. So there are still active lawsuits. So that $842 million that's at the top, that is probably actually closer to 900 million based on what we've learned. But when we developed this through Bloom, Kentucky, it was really to create an opportunity for agencies and organizations who are serving kids and families who have been impacted by the opioid epidemic to know what resources are available to them to continue to broaden their services, to create more opportunities for families who have been impacted by the opioid epidemic. So this is just a flow chart showing that in Kentucky, this is not the same in every state, but in Kentucky, we have 50% of our funds that go to an opioid abatement advisory commission. And this is hosted in the Attorney General's office. And then the other 50% goes directly to counties, cities, and then consolidated local governments and jurisdictions. I think there are 296 jurisdictions defined there. And this is over an 18-year time period. The Opioid Abatement Advisory Commission has set up a portal where there's a granting process. And then the other 50%, the counties and cities, they do it a little bit differently. So Barry had mentioned that he's on the Louisville Opioid Abatement Commission. Louisville set one up. It's we're getting a larger amount of money here in Louisville. So they are using kind of a similar process for taking applications and granting those funds. But I want folks to really think about the connection between resilience building, addressing adverse childhood experiences, and the potential for preventing opioid use disorder or substance use disorder for before kids hit adulthood. On the next slide, there's a little bit more information about what opioid settlement funds are allowed to be used for. And this is directly from the Attorney General's website. We can drop in links or figure out maybe how to get links to folks after the fact. But this is how it's defined. Funds may be used to deliver prevention, treatment, and or recovery social support services to children and families. So when we think about prevention, thinking about resilience building at a young age, starting in the family, in the community, addressing that stress and those stressors at the time that they are happening, so that kids have the ability to develop those coping skills that are healthy and that are not where we're leaning on substances that later lead to problematic issues and health and behavioral health issues. On the next slide, the Attorney General's office has a website where all of the grants that they have awarded are listed. They're not in great detail, but who has received them, where they're serving, and they determine, I think, the prevention grants and how it's defined prevention and how it's defined treatment and recovery. But so far, they've already awarded $32 million. They're opening up their portal again. The portal is open again, I think through March 31st. And we can direct links, but if folks are interested in figuring out would the services and supports that you are providing to your kids, or if you've got ideas around, we really want to get into addressing substance use disorders in childhood or in young adults, consider this as an opportunity to apply for funds and see what happens. I think it's worth the attempt. And we have a toolkit on our website for Bloom, Kentucky that kind of walks through more information, more details on what prevention looks like. And then finally, on the last slide, it's just a pitch. If you were in Kentucky on Wednesday, January 24th, on the next slide, there's just like a little promo for Children's Advocacy Week. On January 24th, we will be at the Capitol raising awareness around issues that impact kids and families. We're also doing virtual and in-person events the entire week. If you want to know more about the advocacy opportunities that are available, we would love for you to join any and all of those. And I will turn it back over to Allie to help us with the Q&A.
Awesome. Thank you so much, Dr. Moody. That was fantastic. And thank you to all three of you. You gave some really great presentations. So we have some time now for questions. If you have any questions for any of our panelists, feel free to put them in the Q&A or the chat. There were a couple of questions that popped up during the presentations that I think were answered later on. So I marked those as answered. But if you feel like you need more clarification, go ahead and put it back in. Starting off, Dr. White, there is a request for you to connect after the webinar is over, and I have copied all of that down, and I will send that to you so we can get the two of you connected. One person asked, are there enhancements for childcare, working with organizations who serve with SUD to get them to prenatal or family planning appointments and they cannot take their children with them? They need safe childcare and transportation for healthcare appointments, particularly in our rural communities. There are some free transportation options, but they do not allow children or infants to join the parents. Does anyone have any answers, comments about that?
I can speak to an example that is not in a rural area. There are things that are called crisis childcare centers. There is only one in the state of Kentucky right now, and I would really love to see that continue to grow, especially in our more rural areas. There are probably other examples of this, but states provide crisis childcare in different ways, Missouri being one of those states that provides it. It's the Nest in Lexington. They provide what they consider crisis childcare. And it's for when parents have to go to court, if there's domestic violence issues. They will cover childcare for if they have to go to a job interview or things like that. And yeah, the question or the response about not being able to take their kids, that's really difficult. And I think what we would really love to see is the managed care organizations consider what alternative options there are for things like that, because we know that if you're caring for a child or children, that transportation is a real barrier to services.
Thank you, Dr. Moody. We have one question about the opioid abatement commission funds. Are they available for for-profit organizations or just nonprofit? Barry, or Dr. Moody, do you know the answer to that?
Yes, I mean, actually, as I understand it, it's available for both.
Okay, great. Thank you so much. Some people have asked the name of and links for the website to apply for this funding. I will make sure all of that is included when I send out an email after the webinar. We'll have all the slides, the recording of this, and we'll have all of those links for you all. One question, in a children's substance prevention program, what would you say would be the most important thing to teach children in grades 4th through 6th?
Well, I would go back to those 4 building blocks that Dr. Moody went over in detail. It is shocking to me, and my ACE score is 0 or -2. When I first started learning about ACEs, I couldn't imagine that these things actually happen to people, because my world that I grew up in was so foreign. Having always felt loved, having always felt like I had agency, and so many of our little Kentuckians don't have this. So I think that caring adult, you've got that caring adult, that wrestling coach, that Sunday school teacher, that nosy next door neighbor that bakes cookies and hands them over the fence and makes people feel important and listens to them. Our YRBS, which is Youth Behavioral Survey, did a survey, and I don't have the latest, and it just came out, so I apologize, I don't have the latest data, but they asked junior high kids, when you leave the house, does an adult know where you're going? And 72% of them said yes, which means that's a big percentage of times that kids leave the house junior high age and nobody knows where they are, where they're going, or what they're doing. They need to feel like they're important, and then they can treat themselves as important if they get that importance from the adults around them. Dr. Moody?
I would also, I think Dr. White covered it so well. I would also encourage letting your kids fail in safe, supported ways, starting at very early on, but making it okay to kind of embrace failure as a part of living, because that is a really critical skill that kids, there's a lot of comparison with their peers, but it's a really critical skill that kids need in order to utilize those coping mechanisms when things do not go their way. So that would be the other thing too, I think.
Thank you both so much. One other question, has the topic of rent control been discussed during these discussions on the housing crisis?
Yeah, yes, it has been discussed. I think folks who are in decision-making roles get a lot of information from a lot of different sources with different, different things in mind as far as like what their emphasis is. So I don't know what the feasibility of rent control is, other than we've heard concerns about it. So I would say keep talking to your elected officials about the importance of that. And obviously the importance of affordable housing is critical to discuss. And then also just having enough units. We actually, we have a lot of places in our state where housing isn't affordable and there are actually not enough units. So that drives up the cost of the housing.
Thank you. One person asked, are there any other intervention or prevention steps you all think need to be taken to help with this crisis? So is there like maybe a top one that you think would be most important to take, or top few?
Well, there would be a top few, because if there was just one solution, we would have already done it and we'd be past this. It is so complex. It involves all of those things underground in that ACEs tree, insecure homes, violence, housing, and then what happens in the home and the community. Again, I'm going back to those 4 building blocks. It sounds pretty simple, and I'm so glad that Amalia put in about thriving, strengthening families programs that the cabinet works on, parent cafes, thriving youth, all of those things. If you're not familiar with that, reach out to me, because it is something that's happening across the state. And if we could just there's so many good things happening. If we could scale them all up. And so that's where we go to Barry, where he has his grants. But the more we can scale those things up and get people talking to each other and understanding they all have similar problems and how they can love and help each other, that's going to make a big difference.
I love Dr. White's answer, and would also just say, I think piggybacking on that, destigmatizing help seeking. How do we make it okay to ask for help? Because like Dr. White said, we have a lot of beautiful, really effective resources across the state. But sometimes if we're not reaching out for those, access to resources, it's not clear of the need. So the more that we can encourage folks to seek help, it's okay to struggle. It's okay to fail. It's okay to ask for help, and it's really encouraged, and making sure that there's no judgment on the end of, providing the help.
Thank you both. We have a couple of other questions, but unfortunately we are just about out of time. I have copied your questions down. I will get them to our speakers, and if they have any insights they can give you, they will we'll make sure we get you all connected. So thank you all again to Dr. Moody, Dr. White, and Barry for giving these great presentations today. They were so insightful, and I know it took time to put together, and I just can't thank you enough. Thank you to everyone who is in attendance. Like I said, I will be sending out the recording from this. I'll send the slides and any links that I can, and get you all the tools and resources that you need. If you have any follow-up questions, there's an email up on your screen now. Don't hesitate to send anything on to me, and I will get that to who it needs to go to. So with that, thank you. Have a great rest of your Friday and weekend, and stay warm. Bye, everyone.